Hi everyone, this is Ye from youngQi Clinic. Today I'm going to share an interesting case with everyone. The patient is an Asian male who is about 80 years old. He had the difficulty of breath happened at the end of year 2011, and his family sent him to the hospital emergency room for the treatment. The doctor found out that he has the excess water within his lung, which we call pleural effusion, and the doctor gave him the medication to expel the excess water within his body. He felt much better around 7 to 8 o'clock, so he can went back to home with the medication. But the problem is, this kind of situation happened 3 times within 1 month, which is a lot of burden to the patient. So his family called us to ask for help. From the Chinese medicine diagnosis, we noticed that the patient's problem is not actually from his lung, but actually from his heart. That's because the heart are actually more powerful during the middle of the day, but also the weakest in the middle of the night. And the patient have this kind of situation happen in particular time in the winter and also in the middle of the night, which leading us to find a clue that he actually has the problem with his heart, but not his lung. So we gave him the medication to enhance the heart power, and after the treatment, the patient no longer have the dyspnea problem, and till now he's still living well. And we know that in Western medicine, they also noticed that the patient who has this kind of short of breath problem and happen in the middle of the night, normally because he has the left ventricular failure issue, which causing the hypertension in his lung, and which causing and leading to the problem that's the excess water within his lung. So in the Western medicine, they also know the root cause actually from his heart, but not from his lung. But in this case, we can notice that the Chinese medicine in treating the patient is much effective than the Western medicine. So we can to solve the problem, the patient no longer need to have this short of breath and being sent to the ER during the night. Until now, the patient is still living well, and that gave us a time to help medicine and Western medicine point of view, both leading us to find the root cause is actually from the patient's heart, but not his lung. But after the treatment, we noticed that the Chinese medicine treatment is actually much effective than the Western medicine. So the patient no longer have this kind of problem. And that's for all. Thanks for everybody.